are a charity that funds research into potentially disease-modifying treatments for Parkinson's, so things that might slow, stop, or reverse the progress of the disease. But I'm here today to talk to you about a survey we've been working on this year in conjunction with a meeting called Rallying to the Challenge. I'm going to tell you a little bit about that survey and a bit about rallying, and then give you some of our top line results. And we hope this might help you understand the potential benefits of taking part in research and also inform some potential questions to ask before participating, because it can be a really daunting process trying to decide what to do. So for those of you who haven't heard of it before, Rallying to the Challenge is a meeting that's held every year. It was set up by people with Parkinson's, some advocates and their care partners, to help the Parkinson's community understand how they can accelerate clinical research. So this survey, and every year there's a survey written and it's helped to help with discussion at the meeting. This survey was built off the initial survey that was published in 2014, looking at the challenges of clinical trial improvement in Parkinson's. So we wanted to look at the barriers, motivators, and facilitators of participation in clinical trials in Parkinson's, or more simply, what makes participation harder, what makes participation easier, and what is the current experience of participation before, during, and after a trial. It was open to everyone with Parkinson's, so whether or not they had previously participated in a clinical trial. And we also collected a lot of demographic data. And we did this because we wanted to understand who is answering these questions, who is currently participating in clinical trials, and why this might be. So we started off by doing a scan of any relevant literature and resources, of which there's not a huge amount currently. And we collaborated with an amazing group of Parkinson's advocates who really helped shape the questions into the most meaningful questions they could be for them to take forwards, with a team at University of Plymouth, and then also in particular with Dr. Emma Lane at Cardiff University, who really helped to guide and drive this survey forwards. We then presented our top line data, which I'm going to be sharing some of with you today, at the Rallying to the Challenge meeting in Michigan in September. And the survey is now closed and we're in the process of analysing the full data sets. So why have we done this now? This data hasn't really been captured before and isn't generally being done all the time by clinical trial teams. So we want to understand this information because there are more phase 2 and phase 3 trials currently ongoing or about to become ongoing, which require more people with Parkinson's to participate, and generally for a longer period of time as well. So we need to understand what is the current experience of clinical trials and of participating in clinical trials, and how can we improve that? And importantly, how can we make this research more accessible to a broader demographic of people who are more representative of the general population? So this is our interim analysis of the data. This was from September, and at the time we had about 700, just over 700 responses to the survey. Now it's closed, and that was very nearly 800 when we closed it. And that really exceeded our expectations, because if anyone watching took part in this survey, you will know it was not a short survey. So we're really, really grateful to people who stuck through it to the end. And the first thing we wanted to understand is how many of the people that were talking to us through the survey, how many of them had previously participated in a clinical trial. And by clinical trial in this context, we mean things like drug intervention studies, cell or gene therapies. So generally the slightly more invasive clinical trials rather than the observational kind. And of the people we were talking to, just over 80% had not participated. And this is in line with what we were expecting. And of the just under 20% that had previously participated, a majority of them had participated in drug intervention studies. And of both of these groups, there was a fairly even split between male and female, with slightly more male in both groups. And again, this is in line with what we expected. This is all the demographic data I've got for you today, but going forwards, we're going to look at all of our answers in the context of the demographics that we collected to understand how different groups of people see barriers to participation differently, as we think this is going to be really important going forwards for recruitment. So the three key things we wanted to understand were what were the barriers, facilitators, and motivators to participation, and what makes it harder, easier, and what motivates people to participate. In terms of the barriers, the top things people tended to indicate were the physical effects of the trial. So the possible side effects or more invasive procedures, and in particular things like brain surgery, as is very understandable. But one thing that stood out to us from the trial naive group, and I should have said we've termed this trial naive for people that haven't participated, and trial experience for those who have, and we appreciate that these are not the ideal terms to be using. However, I'm just going to use them today for clarity, and going forwards we'll hopefully use something else. So the perceived risk might outweigh the potential benefit for the trial naive group. And this was interesting to us because it maybe suggests that the trial experience group had a slightly higher threshold for risk, but also the fact that they maybe have experienced benefits that aren't immediately obvious to the trial naive group. The key facilitator that stood out from both groups was communication, both here in terms of the direct line of communication to the trial team, but throughout the survey that was really picked out again and again as something really important for participation. So for example, if there are reimbursements of costs incurred during the trial, so for example, your travel to and from a trial centre, is it well communicated how that happens, and is that process easy to complete? One thing that I'm going to come on to again in a minute is the formal guidance for being in an off medication state. So what we mean by this is that participants have stopped taking their medication at least 12 hours prior to an assessment. So when they arrive, they're completely off their medication. And that was really important, that guidance of this was in process. Sorry about the phone. In process for the trial naive group. And I'm going to come on to this again in a second. So in terms of the motivators, the trial naive group were highly motivated by the intervention itself or access to this intervention. However, for the trial experience group, their motivating factors were changed by experience. And what might give some explanation to that could be from looking at what the trial experience group felt they benefited from participating in clinical research. And that's what this graph here shows. So the things that the trial experience group tended to benefit from were benefit to others, being part of something important, an increased knowledge of Parkinson's, being able to spend more time with healthcare professionals or the clinical trial team, something that we anecdotally know to be really important, an improved well-being or quality of life, improved symptomatic management, finding people in the Parkinson's community by actively engaging with Parkinson's, and improved symptoms. However, what's really obvious here is that improved symptoms and symptomatic management is quite low down the list. However, for the trial experience group, it's still a motivating factor. So this does suggest that despite the fact that we need some kind of expectation management in terms of what might happen to your symptoms, particularly in disease modifying trials, and that came out through some of the comments we gained, there's still hope going forwards, and they're still looking to these trials for that benefit. And then we also picked out of the question asking about facilitating clinical trials, so what makes it easier. We picked out different aspects that might that include communication. So just beyond just looking at the direct line of communication to the trial team, something that's really important to the trial naive group was this guidance for things like off medication assessments, for imaging and procedures, guidance for care partners for the same thing. And you can see that it's relatively much higher for the trial naive group in orange than it is for the trial experience group in blue. And we think that this might be because for the trial experience group, by nature of the name, they've experienced these things before. So they have their strategies in place. They know what to do when they're on their way to an assessment of medication because they've done it before and they've practiced. However, for the trial naive group, this is a hugely daunting prospect. And we think that maybe going forward, there could be some way of using this experience and sharing this experience between participation. On top of this, you can see that the trial naive group indicated that they would quite like to have communication with someone independent to the trial team. So a third party, for example, maybe a research buddy, someone that's previously taken part in research and again could share that information, share that knowledge. Or someone like a community representative, someone they could ask questions to without feeling like they're compromising their position on the trial. And just very quickly wanted to point out here some of the limitations of this survey. Obviously, this was an English survey that we distributed purely online. So we had very few people talking about having different language options and wanting different medias for clinical trial information. However, we anticipate that this is something we'll look more into as we go forwards. So what would make it easier to participate? We took this forward to our meeting in America and asked our focus group, how can we provide better access to trials? How and when can guidance for off-medication assessments be given effectively? How can we put trial naive groups in contact with people who have this experience or someone that's not connected to the trial? How can psychological support be made more clearly available? And if it is available, how do we communicate that? How can we improve facilitation of work and childcare commitments? Again, this isn't something we looked into in a huge amount of detail in the survey. However, it was pulled out quite a lot of the answers, so it appears to be really important for people. And how can we improve guidance and support for care partners? And some of the things that really stood out from this conversation included things like being given really basic information with helpful terminology very early on. So when you hear about the trial, do you immediately understand whether or not you might even be suitable for the trial? Is there an opportunity to ask someone in person questions about the trial? And that would be really helpful in order to facilitate participation at that stage. So thank you very much for listening, and I hope this has given you some insight into participation in clinical trials. I do want to quickly say that there are lots of ways to participate in research that aren't necessarily taking part in invasive clinical trials. Even by nature of being here, you're probably taking part in PD Frontline, which is fantastic. But you can also do things like surveys like this or platforms like Fox Insights. So there's lots of different things to get involved with. And if you have any questions, please do reach out to us. I put our website here on the screen. You can sign up to our newsletter. This was just a really tiny section of our results, so you can be kept informed for when we publish our full results. And you can also watch our top line results at the Rallying to the Challenge meeting. And then finally, some acknowledgements. There are a huge amount of people who helped us build the survey, including Georgia, who's going to speak later. But in particular, Dr. Emma Lane from Cardiff and Helen Matthews from Cure Parkinson's were really influential. So thank you very much.